Hi, and welcome to our podcast. I'm Brent Dodge, and I have with me Gary Gales, a physical therapist at Alpine Physical Therapy. Today we're going to be talking about some back care strategies. And I really appreciate the fact that Gary is here. Gary is an expert when it comes to helping clients who have back pain in terms of guiding them through the educational and exercise process. Gary, we're glad you're here today.
Thank you.
Hey, Gary, could you just let the viewers know what you're looking for when someone comes in with back pain? What are you thinking in terms of helping that individual?
Well, when someone comes in, we want to do an individualized evaluation for them and make sure that what is the cause of their back pain, and then use that to develop a plan for them to get back to function. So I guess what I'm looking for is how severely their back pain is, how long have they had their back pain, what do they do, and what we need to get them back to doing what they're doing without pain.
So you've begun to evaluate, you're getting an idea about the person's condition. What are some things that you might start with early on when somebody has pain, and then what would you move them into as they begin to go through a guided process?
Well, we need to get them back to movement, but a lot of people have muscle imbalances. They might need a gentle stretching program, and sometimes that will alleviate quite a bit of their pain. But once we have the stretching program in place, then we need to get them to start activating their core muscles, the muscles that are going to actually stabilize and hold their back in what we call a good neutral spine.
Do you think that a lot of people come in with the idea that maybe you're just going to do something to them as opposed to guiding them through a process that they can do perhaps at home or at a gym?
Yeah, exactly. Physical therapy is physical, and it has to be the patient who does the exercise. We have to give them the information, give them the education to get themselves back into shape and allow the body to heal itself.
Gary, somebody's been going through your program, you're working on various strategies. What types of things would you expect that they would transition to? And particularly for our viewing audience, what might they expect as they begin to transition to those later phases of care for their back?
Well, here at Alpine Physical Therapy at the Peak, we have a lot of great opportunities to transition them from starting, say, with a pool program where they can move unweighted or with very little weight in a buoyant environment. We can transition them then to, say, a Pilates, a land-based program, and then on to more aerobic and strengthening exercises here at the Peak. And then finally, what's most important is that they have a program that they're going to do to maintain their gains and their function and to increase it throughout their life.
Gary, you've hit on a variety of strategies that people might expect if they were to come to Alpine for physical therapy for their back. Do you have any other specific strategies you want to address to our viewing audience?
Yeah, I think it's important that they will learn how to move differently, how to manage their back from a movement perspective and from a postural perspective so that they are putting their back in the best possible position at all times. And when they learn this will become habit. And I think this is super important.
Well, you know, one of the things I've found too is that when you have somebody who's been in pain and you can help them move or position their body better, a lot of times that addresses their pain, you know, to the point that they can get back to activity and really protect their back for the long haul. Well, Gary, that's been some great information for our viewing audience. Why don't we take a break right now? When we come back, we'll have the tip of the day. And this is the tip of the day for back care strategy.
With sitting, our back doesn't necessarily like the sitting position. But if you do have to sit, what you want is your hips slightly higher than the knees. A lot of chairs don't accommodate that for normal sized people. So what we want to do here, her hips are just about even or slightly lower. What we're going to do is add a pillow to that, and that's going to put her back in a little better position. So have you come up and there. Now, hips slightly higher than the knees. That puts her pelvis and back in a lot better position. She should be able to maintain that a lot better with what we call the neutral spine, or the muscles supporting the back in the best position possible. And that's the tip of the day.
Thanks for joining us for this podcast on the topic of back care strategies with physical therapist Gary Gales. If you have any additional questions on our approach at Alpine to back care, be sure to visit our website at www.alpineptmissoula.com or call us here at the South Clinic, which is in the Peak Health and Wellness Center, at 251-2323.